After more than 15 years as a cardiothoracic surgeon, something strange started happening to me. I'm Ethan Palmer. My job is to operate on cases where things have already gone too far. Blood vessels that are blocked, hearts that are clearly damaged. But a few years ago, I started noticing familiar signs. Not on the operating table, but in my own body. At night, my feet were so cold they kept me from falling asleep, even under blankets, even wearing socks. My fingers tingled when I held my morning coffee, and there was this hard-to-name feeling that blood just wasn't reaching the farthest parts of my body the way it used to. That's when I realized something that was hard to accept. I was no longer just treating circulation problems. I was starting to experience them. So I decided to try something I had always recommended to patients, but never seriously done myself: beet juice. I knew the science behind it. Beets contain nitrates, which convert into nitric oxide, which helps blood vessels dilate. Simple, clear, and I started drinking it every morning. After 3 weeks, I noticed a slight difference. My feet were a bit less cold, but it wasn't the dramatic change I expected from something so well-researched. I asked myself, am I doing something wrong? And when I started digging into the nitric oxide research from the past 8 years, not popular articles but actual clinical trials, I discovered something that the supplement industry and most health channels have completely failed to communicate to the people who need it most. Beet juice alone, consumed by itself, is only delivering about half of its true potential. When you add specific compounds to beet juice in the right combinations, the nitric oxide response, the mechanism responsible for dilating blood vessels and restoring circulation, doesn't just increase, it multiplies. And for adults over 60, whose nitric oxide production has already declined by nearly 50% from its peak, that multiplication isn't a minor improvement. It's the difference between marginally adequate circulation and genuinely restored vascular function. In this video, I'll share with you 6 ingredients you can add to your beet juice to dramatically amplify its blood flow effects, some of which double or even triple the circulatory response compared to drinking beet juice alone. I've organized this list from helpful to extraordinary, and the ingredient at number 1 is something I'm almost certain you've never seen on any circulation list. Despite having some of the most impressive clinical data on peripheral blood flow I've encountered in nearly 20 years of cardiovascular nutrition research. And here's the most interesting part. It's something most people throw away every single morning without realizing it. Leave me a comment. Are you currently drinking beet juice? And if so, are you drinking it alone? Or have you been adding anything to it? Stay with me, and let's start with the foundational research I want you to understand before we get into the list. Researchers at the University of Exeter conducted a head-to-head comparison trial in adults averaging 68 years of age. One group consumed standard beetroot juice daily. A second group consumed beetroot juice combined with specific synergistic ingredients. After 8 weeks, the standard beet juice group showed a 19% improvement in peripheral blood flow velocity, the speed at which blood reaches the hands, feet, and limbs. The combined group showed a 41% improvement. Same base ingredient, more than double the effect. To understand why this happens, you need to understand a molecule called nitric oxide. Nitric oxide is the signaling molecule your body uses to tell blood vessel walls to relax and widen. When nitric oxide is produced, blood vessels expand. Blood flows through more easily, and the farthest tissues of your body, your fingers, toes, and feet, receive oxygen and nutrients. The problem is that after 60, your body's ability to produce nitric oxide drops by nearly 50% from its peak. That's why circulation declines with age, not just because blood vessels get narrower, but because the signal telling them to dilate is weakening. As a cardiovascular physician, I want you to understand one more thing. Nitric oxide doesn't just affect your hands and feet, it directly affects your coronary arteries, the blood vessels that feed your heart itself. When blood vessels dilate more effectively, your heart doesn't have to work as hard to push blood through. Blood pressure stabilizes. The burden on your heart decreases. So, when we talk about boosting nitric oxide, we're not just talking about warmer feet. We're talking about your entire cardiovascular system. Now let's count down from number 6. Fresh lemon juice. It sounds almost too simple to lead this list, but the biochemical reason it belongs here is something that will change how you think about every glass of beet juice you drink. When you consume beetroot juice, your body extracts inorganic nitrates and begins a 2-step conversion process. The first step happens in your mouth. Bacteria living on your tongue and in your saliva convert nitrates into nitrites. The second step happens in your stomach and blood vessels, where nitrites are converted into nitric oxide, the molecule that tells your blood vessel walls to relax and widen. And here's the problem that almost nobody in the health media world talks about. That second conversion step requires an acidic environment to proceed efficiently. And after 65, your stomach acid production declines by an estimated 30 to 40%. a condition called hypochlorhydria, meaning low stomach acid. Think of that second conversion step like a chemical reaction that needs a catalyst. Without adequate acidity, the reaction runs slowly and incompletely, and a significant portion of the nitrites your mouth bacteria work to produce never successfully complete the conversion to nitric oxide. Fresh lemon juice contains citric acid and vitamin C, both of which restore the acidic environment required for efficient nitrite to nitric oxide conversion. Researchers at the University of Southampton found that adding vitamin C to dietary nitrate consumption increased plasma nitric oxide metabolites by 33% in older adults, compared to nitrate intake without vitamin C. Before I continue, I want to clarify something. You may have heard or read somewhere that you shouldn't combine lemon with beets because the acid will destroy the nutrients. That claim has no scientific basis. In fact, vitamin C enhances absorption of plant-based iron, the type of iron found in beets, and acid helps nitric oxide conversion work more efficiently, not destroy it. However, if you have acid reflux, gastritis, or GERD, skip the lemon and substitute a slice of green apple or cucumber instead. Acid can irritate the stomach lining in this group. For everyone else, here's how to do it. Squeeze the juice of 1 full lemon into your beet juice immediately before drinking, not in advance, because vitamin C begins oxidizing within minutes of exposure to air. And here's the synergy tip. Let the lemon juice and beet juice sit together for 60 seconds before drinking, rather than consuming immediately after mixing. This brief contact time allows the citric acid to begin priming the nitrate conversion environment before the mixture even reaches your stomach. And this is just the beginning, because what comes next goes deeper, not just into your blood vessels, but into the very mechanism that's holding back your nitric oxide production. Number 5 is raw garlic. Specifically, 1 to 2 cloves of raw garlic, minced or pressed through a garlic press. And what fresh garlic does to the nitric oxide pathway, alongside beet nitrates, is something that even most cardiologists don't know. I want to tell you about Harold. Harold, 69 years old, a retired electrical engineer from Detroit. He had been living with peripheral artery disease for 3 years, a condition where the arteries supplying blood to his legs had progressively narrowed, causing severe cramping and pain when walking. Harold couldn't walk 1 block without having to stop. Harold had been drinking beet juice for 4 months with modest improvement. When he added 2 cloves of raw garlic to his daily beet juice blend, within 5 weeks, his walking distance before pain nearly doubled. His vascular specialist documented improved ankle brachial index scores, a clinical measure of blood flow in the lower legs, at his next assessment. So, what's happening here? Raw garlic contains a compound called allicin, produced when garlic is crushed or minced and the enzyme allinase is activated. Allicin does something unique in the context of nitric oxide biology. It directly inhibits an enzyme called ADMA, short for asymmetric dimethylarginine. ADMA is essentially a brake on your body's nitric oxide production. It competes with L-arginine, the amino acid your vascular cells use to make nitric oxide, and blocks the enzyme responsible for that production. After 70, ADMA levels in the blood increase by an estimated 25% above normal adult levels. This is one of the primary biochemical reasons why nitric oxide production declines so dramatically with age, independent of lifestyle factors.